Hello, welcome to the Well of Wellbeing. My name is Dr. Gracia. Today we'll be looking at the topic of depression and feelings of sadness. I have a panel of 3 experts: Dr. Saman Khan, consultant psychiatrist for young people; Dr. Khadija Mirza, consultant psychiatrist for people with early signs of psychosis. I'll have a brief interview with each one of them to hear what they do and how feelings of sadness and depression can affect us. Most importantly, they will be sharing wisdom on how to stay well. Dr. Khan, hello.
Hi.
Hi.
How are you?
Fine, thank you. Tell us a little bit of what you do and what your work is like.
So my name is Saman Khan, and I'm a child and adolescent psychiatrist. I'm based in a huge health centre with lots of GP practices in Rutherglen, in Lanarkshire, and I work with, as you mentioned, children and young people, so up to the age of 18.
How many people would you say, or how many young people, or even, children, would you say you could see presenting with depression?
Depression incidence changes over time. So in very young children, it is very rare. But as the child gets older, we see more and more. So I think the last estimate was that about 1 in 5 people in a classroom would have some kind of mental illness, but not necessarily just depression. It talks about all mental illness. But as you approach adolescent, from the age of 14, the kind of rates of depression are almost the same as what we see in adults.
As a parent, how do I know that my child is just not feeling a little bit sad and this is depression? What would be the things I should be looking out for?
Sure, I think it's really important to know that there are differences in the way depression presents in adults compared to how it presents when in kind of younger kids. As a parent, it can be really difficult to figure out what's normal teenage behavior and what's depression, because all teenagers can be quite broody, can stay in their rooms and not share what's happening in school or with their friends. Feeling sad is a normal emotion. We all feel it, and nobody is happy all the time. We have periods when we're happy, periods when we're sad. But it's when that sadness persists for a longer period of over 2 weeks, that's when we would start kind of getting concerned that this is a different behavior or kind of something that needs our input. Thinking in terms of teenagers is, when they start to, you might notice that they're more prickly, more irritable, spending more time in their room than even more, maybe kind of you might notice that they're not eating as much as they would normally, so their appetite goes down, or you might even notice that they're eating a lot, so it can be either way. Their sleep might get disrupted, so you might notice that they're not, they're sleeping even later, and up early, and they might not be looking after themselves as well as they normally would. They might even kind of find that you just getting up in the morning is even more difficult and may start refusing school. So these are, I guess, the signs that you would think, and if they persist for a longer period, that's when you would start getting worried and say, no, this is not just normal sadness, there's more to it.
Yeah. Well, that's really helpful to hear, that it's really to look at that pattern and base it on how we know them and seeing any changes. So how would you say we could, what would be the main differences between depression in young people and adults? Or is there any difference really?
So as I mentioned, there can be a difference, and they might, adults might would more become more withdrawn, and you might notice that their interactions will reduce. But with young people, they might still be spending time with you, but it'd be more, they'd be more angry, they'd be getting into more arguments, they'd become more irritable, and they might actually still see their friends, but it's the quality of the time they spend with their friends that becomes affected, which you might not be aware of. Also, what you might notice is their school performance might go down. So they might be achieving a certain target, but then teachers report that the child is not concentrating or their grades are going down. So that's another indication that, things are not right.
Well, that's really important for us to hear. So when do we decide that this is not just bad behavior, but this is depression? Are there some things that they start saying, or is there a different things that we should be looking out for?
Yeah, well, there will be some commonalities. So there would be a degree of hopelessness. They might even voice suicidal thoughts that life is not worth living anymore. And they might be showing it in different ways. They might be self-harming, and you might become aware of that. So I think it's really important that if it gets to that stage, that they do require help, and you really need to go in and get them seen by their GP.
So what would be your advice in terms of looking after oneself, whether it's a young person or their parents? How do we help young people stay well mentally, specifically with regard to depression?
Sure. I think it's even more important that we are looking after ourselves and our children's mental health during this time when there's so much anxiety around about COVID, especially. It's about maintaining a good routine. So sleeping on time at a certain time every day. I know it's difficult when you're at home and you don't have school to kind of have late nights, and I've got teenage boys, and it is a struggle, but it's really important that you try very hard to maintain a structure, obviously with flexibility in it. But they still need their sleep. Teenagers need more sleep. Their brains are developing at a much faster rate. Their body's changing much faster. Yeah. Sleep is really important. Having a good diet is really important. Kind of getting regular exercise. So we're allowed kind of exercise, so we should use that and kind of make sure that kids get some fresh air, are kind of involved in some kind of activity every day, even if it's playing in the garden, but something. And kind of think about positive talk and not kind of passing on your own anxieties. Sometimes as parents have to be like super parents at this stage. You have to kind of model your behavior and show that you're coping, and that will teach your child that they can cope too. So it's really important that you kind of look after yourself so you're available for your child and young person. It's really important that we need to be more forgiving, more tolerant of each other at this time, and not to react. If teenagers do have difficult behaviors or get angry, not to react by arguing back with them, because teenagers don't listen. They will argue back till the death, and the best way to manage that is you do not reply to them, and kind of maintain your sanity, but also kind of you're modeling that actually you're not reacting to the stress that your child is projecting onto you. So that's really, really important.
Wow, I love that. So forgiveness and respecting each other. Well, Dr. Khan, thank you so much for giving us this time of your day.
Thank you so much, Gracia.
Hi, Khadija.
Hi, Gracia. Hi, lovely to be here.
Thank you. Lovely to have you. Khadija, would you like to first of all tell us about yourself?
So I'm a psychiatrist, and I work early intervention for psychosis.
Yeah.
I have been doing that job for the last 3 years, and I've been a psychiatrist for, I suppose, about 15 years.
What type of patients would you see?
I see community patients, and we have inpatients as well. So I do review the patients on the ward as well. So it's a very demanding job, and it's between ages of 16 to 35, so quite a young group of patients that we work with. So my remit is in I suppose, with this first episode, psychosis. So I'm not going to get into much detail of that, but it's a crucial time between the ages of 16 to 35 when the brain is developing, the social, there is social development of individuals as well. So, and if somebody's had psychosis, a breakdown in mental health, psychosis can be quite debilitating.
From your experience with psychiatric patients, or even with working with their families, because these will be adult patients that you're going to see, isn't it?
Yeah.
Where would the stigma come from? Why is it that people are still stigmatizing others because they have mental health disorders?
It's a broad, generic view of the society. And I personally, it's the aspiration for perfection that we have. I think the people believe that we all go after things that are nearly perfect, we all do that.
What would you say is the difference between psychosis and depression? Because to a lot of people out there, everyone just said, I had a mental breakdown, and it could mean anything. So what would you say is the difference between the two?
I think you've just hit the nail on the head by saying I had a mental breakdown. Yet again, when I describe this to my patients, it's a huge thing in somebody's life to have a mental breakdown to an extent that they have been admitted in the hospital. I think depression is more of mood symptoms. If somebody's, what I would describe as clinical depression is somebody who's not been sleeping properly, their sleep pattern is disturbed, they are worrying constantly, they're not finding enjoyment in the things they normally would. They are trying to isolate themselves and withdraw from the friends and the society, and they are they're becoming quite negative about perceptions, about things, about critical about people around them. They are not finding they look at the future as quite bleak. The stresses that they're experiencing, they think they're not going to come out of them. They will not get better. So there is this sense of feeling that there is a doom, impending doom there, that things are not going to get better. And that keeps them awake. They ruminate, they worry, they keep thinking about it, and they don't realize they're doing that. Then their appetite goes because they're worrying so much. And then over time, reduce the weight loss. So all these things are quite worrying. Then along with it, they feel guilty. There's a guilt there, letting people down. It graduates from being mild to moderate to going on to the severity where people start having suicidal thoughts. We know that young males, suicide is quite high in those young males because we have this in the society. Men are supposed to get on with things. Women are the ones who talk, chat with friends. But with men and their mental health, we don't often talk about it. So I think there is this mental health awareness around, with men, they need to talk about their mental health because they don't, it's that expectation as a society. It's a bit like on a tricky road. You're on a crossroad, you take the which is leading to somewhere, let's say, end of the road where there is suicidal ideation. And if you don't get any exit out of it, you're going to carry on. The more bumps you get, the more, dodgy road that you have, the more turbulent your journey is towards that. It's probably your car is going to break down quickly on that, unless you take an exit and get it sorted. So I think, with regards to suicidal ideation, people don't talk about that. And then often you hear is that it came out of the blue from someone. Now listen to this. Suicidal thoughts, 20.6 out of 100 people have had suicide. 20.6.
Those are huge numbers, isn't it? And it's really evident that it's something we need to be talking about and allowing people to express. When does someone realize that, no, this is not really depression, or maybe the family, this is not depression, this is psychosis? When does that distinction happen, or does it ever happen?
Psychosis is what I would describe as people who have, there are thoughts and there are behaviors. People who are behaving from an outsider, if they're behaving in an odd way, something that is out of character for them, somebody who's been spending excessively, somebody who is who is probably acting in a very bizarre way that they're normally, they won't. For example, when somebody's drunk, that's different. But if that person is not drunk and in behaving in that bizarre way that you just think, this is not right, you need to take that seriously. You need to have that chat with that person or with their loved ones. There are delusions, which is false, firm beliefs. Delusion is a thought process where people start thinking that there are aliens coming out there going to come and poison my food. And if they're convinced that it is held with that conviction, then that is a delusion. And it's the people who are, these are the people who are not in touch with the reality. That's not normal. And then people will start hearing things and seeing things, and they're talking to themselves. Obviously, people might not tell you if they're having those experiences. If you see somebody acting bizarrely, talking to themselves, that's not right. Pick up a phone and speak to somebody. Go to the GP, because the earlier you get in there, the quicker you can help this person. But some people who are so depressed, they can also tip into psychosis. So, and those are the kind of people who have got lack of support, who don't have the coping strategies, who don't have faith, religion, these supportive mechanisms, then they are the ones who are more prone to developing mental illness. I think the reason mental illness is so common is that we live in a society which is very isolated. We've got so much pressures. We have got so many deadlines. We don't want to seek help. We want to do it all by ourselves. And I think all these pressures, looking good, having a house, car, all of that, everything, these are all adding pressures. And we don't want to seek help there. So I think these are the kind of things that, they make us more vulnerable. Be kind to yourself, be kind to others. Forgiveness, not holding on to the guilt, letting go, forgiving people if somebody's done something wrong to you. All these things, they are so important, because the guilt, the anger, the resentment, the build up. And I think that's not helpful, holding on to all those negative things, and give love to others.
Wow. Khadija, thank you so very much for your time. I only have 5 points to add on depression. So, straight on to it. The first one is that people can feel sad. There is a difference between sadness, usual sadness, and actual depressive episodes. As we heard from one of our speakers, depressive disorders can present as mild, moderate, and severe. It's when it's in the severe group that treatment is often needed and often necessary, and that's when people can feel that there's no point in living, or even experience some psychotic episodes, such as believing in false beliefs, or even hearing things which are not there. So it is an illness at that point, and often needing medical attention. The second point is on the causes of depression. So far, what we know from research is that there are predisposing factors which are linked to depression. These could be that it can run in the family, so there could be some genetic factors linked to them. It could also be linked to certain types of personalities, such as perfectionistic personality or anxious personality, but it can also be linked to early experiences of life, which is often linked to relationship with parents, or even a parental loss, which can be often through separation, but not always. Now, the thing to note is that these are predisposing factors. It doesn't mean that anyone who's had these experiences is definitely going to be depressed, but it just means that they can be predisposed to developing a depressive disorder. Now, we also have precipitating factors which are often linked to the environment. So it could be recent life events. Maybe it's a loss of a job, or loss of a partner, or loss of friendship, or rejection. These can also be linked to some vulnerability factors. For example, if someone found themselves all of a sudden having to care for loads of children, being stuck in a house, and not having any social support. But it can also be as a result of physical illnesses. Now, my next point is what actually happens in our brain. So that's the third point. What we know is that sustained stressful events lead to an activation of an area in our brain. So there are two areas in the brain and a little gland just on top of our kidneys. And this is called the HPA axis. H for hypothalamus, P for pituitary gland, and A for the adrenal glands, which are right on top of our kidneys. This axis cascades when we are really stressed and when there's a sustained stressful event happening. And what they lead to is the production of an element, a chemical, a hormone called cortisol. The effect of that cortisol is to reduce the amount of two other chemicals or neurotransmitters, which are called noradrenaline and serotonin. Noradrenaline and serotonin will work in our brain to keep us motivated, to keep us happy, to keep us wanting to do things, to keep us enjoying food and just getting enjoyment out of our lives. So because those two are reduced, we have symptoms of depression. So the fourth point that I have for us today is, what do we do when we're feeling extremely depressed? And why is it that people are sometimes prescribed medication? So hopefully from the previous point, we can understand why medications such as the usual antidepressants, which are now being prescribed, called serotonin reuptake inhibitors, and sometimes people will say SSRI. These are actually going to be prescribed because they help the neurotransmitters, the two that are reduced by the cortisol, actually work better in our brain. Now, what they would really help with is symptoms of depression, including poor sleep, poor motivation, tiredness, lack of concentration, and lack of enjoyment. So they will help with that. But let's remember that they are not dealing with the root cause of the issue. So often what works best for any treatment of a depressive disorder is actually that one also accesses some talking therapy, which can be in the form of cognitive behavioral therapy or any of the other psychological therapies, or one can access psychotherapy where one sees a psychotherapist, or one can have any other form of counseling, which is always very, very helpful. So very quickly, that was what I had to finish this series, and we are so glad that you are here with us and listening to everything that we have. So please do share if you like this and it was helpful, and subscribe. Thank you.
If you would like help with this or any other topics that we discuss on our videos, please don't hesitate to reach out. We have a Destiny Hope line, which is available 9 to 9 every day, ready to talk. And the number is 0333 900 909. Or you can email the address shown below, which is wellbeing@destiny-church.com, and we would love to address your concerns and just have a chat with you about anything that is worrying you.